name is Dr. Jeffrey King, and I'm a board-certified orthopedic hand surgeon. I'd like to take a few minutes today to talk to you about ulnar nerve problems. Ulnar nerve problems are the second most common cause of numbness and tingling in the hand. Now, in other videos, we've talked about carpal tunnel syndrome, which is the number one cause, and that typically gives you numbness and tingling in these three fingers. When you have ulnar nerve problems, it usually gives you numbness and tingling these other two fingers. Okay. So whether you realize it or not, you probably are all very familiar with your ulnar nerve. We often call it our funny bone. And when you bump your elbow right here, that can be uncomfortable and send shocks up into your little fingers. So that's what we're talking about. The ulnar nerve runs through a tunnel right here, similar to the median nerve and the carpal tunnel in your wrist. But when the ulnar nerve runs through this small tunnel right here, occasionally, and for reasons that we don't always know, it can become irritated. And if that nerve is irritated, that can cause intermittent or symptoms that come and go of numbness and tingling, or constant numbness and tingling in your ring and small fingers. As I said before, if it's your thumb and index finger, it's usually not the ulnar nerve. Now, things that can make your ulnar nerve symptoms worse include bending your elbow. So if you're kind of resting on your elbow, or if you sleep kind of curled up, that puts pressure on your nerve. Or if you repeatedly bend and straighten your elbow for your job or for hobbies, that can aggravate your nerve as well. The most common symptoms are numbness and tingling, but people can notice some weakness in their hand and loss of dexterity from the ulnar nerve problem. So how do we make the diagnosis? Well, there's three parts of a diagnosis. The first is the history, the physical examination, and then any kind of special testing. So based on history we just talked about, when did it start, how is it acting, what makes it better, what makes it worse, those are all very useful pieces of information. Secondly, the physical examination. If we see you, then we can kind of test your nerve at the elbow. We can do some different things, checking your hand and your elbow, and try and see if that fits with that diagnosis of ulnar nerve compression at the elbow. The third thing is special testing. The most common thing with that is ulnar nerve is an EMG, a nerve conduction study test. Although those are not always positive because people sometimes have symptoms when their elbow is bent, but when they do that test, the elbow is straight. So that's a useful piece of information, but it's not the only piece of information that we look at. After you've seen your doctor, you've talked about your history, your exam, any special testing, then you can kind of determine if that seems to be the right diagnosis. If that's the right diagnosis, what are the treatment options? Well, it kind of depends on what your symptoms are. If you're doing fine during the day, but your symptoms are really most severe at night, waking you up from sleep, and you're a side sleeper, or you sleep with your arms curled up, one of the things that can be helpful is to try a wrap or a brace that goes on your elbow. It's usually soft, might be made out of Velcro, might have a little plastic strut in it. And what that does, it helps keep you from bending your elbow up at night when you're sleeping. And for some people, if they wear that at night, it keeps them asleep during the night so they feel better. And that also makes the nerve happier during the day, and they're not as symptomatic during the day. So that might be a good solution if that's what your symptoms are. If that is not helpful, or it's not enough, or you have significant symptoms during the day, then the treatment option may be a surgical release. Unfortunately, there's really no evidence that indicates that doing steroid injections is safe or effective, or that any kind of therapy or topical rubs or creams is effective. So if your symptoms are significant and bothersome, then a surgery for this problem might be helpful. The surgical treatment for ulnar nerve problems is usually an outpatient surgery. You can go home the same day. We will usually do it with a little bit of sedation, make you sleepy. And then once you're sleepy, we numb up this part of your elbow right here. There's a bump on the tip and there's a bump on the side, and the nerve lives right in between those two bumps. And most of the time, once we make you sleepy and we wash your arm up, we can put some numbing medicine in there and then do a little incision about that big, maybe an inch long, and then we can see the nerve and we can take all the pressure off of the nerve. So doing a procedure to take the pressure off the nerve but leaving it in place is generally effective for this problem. After we do the surgery, we just put a couple of stitches in there, and we put a soft wrap, a soft dressing on your arm. We let you start moving right away. You can use your arm right away for things like holding a fork, holding a pen, checking your email, buttoning buttons, zipping zippers. but nothing more than a pound. So we don't want you leaning on your elbow. We don't want you lifting heavy things or doing repetitive bending with your elbow for about 2 weeks. After about 4 or 5 days, you can take that first dressing off. At that point, you can put a Band-Aid on it and you can get it wet in the shower. We don't want you putting ointments or salves or anything like that. We don't want you sitting in hot tubs or soaking in it all. And generally, we would see you back in about 2 weeks, see how you're doing. At that point, we can ease your restrictions a little bit for the next 2 to 4 weeks, nothing more than about 5 pounds. And then at that point, by that, people are usually feeling better and we can lift their restrictions altogether. If your symptoms are intermittent, they're coming and going, then often after we do the surgery, the symptoms are completely gone. If your symptoms are constant or you have weakness in your hand, then sometimes even after we take pressure off the nerve can heal over time, and that time can be anywhere from 6 to 12, even up to 18 months. We've seen healing with that. Now, what I described is what's called an in situ release, means we leave the nerve right where it is. Another option that some people think is a good idea is what's called an anterior transposition. It's a bigger incision, and we actually take the nerve and we move it from this spot back here to a point on the side. I don't do that operation very much. We occasionally do it if people's nerve is jumping, but that's something that you would want to speak with me or your hand surgeon with if you were concerned about which surgery was best for you. With any operation, there's risks that go along with the surgery. They're real, but they're small. With any operation, there's a risk of infection. That risk is about 1%. It's higher if you smoke, or if you have diabetes, if you take steroids, or use immunosuppressive medications. There's also a risk that the surgeon could injure your nerve at your elbow while he's working on it. That we take that very seriously. That risk is very small. There's a risk that you might not get better. We talked about that. That might be because of an incomplete release, or that the nerve just didn't have an opportunity to recover, or that there was actually a problem somewhere else besides your elbow. You can get similar symptoms with problems in your neck. That's pretty uncommon. And there is a place that the ulnar nerve runs through your hand on the way to the pinky, although that's a very, very uncommon site for pressure. There's a risk that you would have a tender scar on the inside of your elbow. That scar is always tender, but with a little bit of massage and therapy on your own, that will usually get better. And then there's finally a risk of anesthesia. We generally do this with some type of sedation or light anesthesia rather than a general endotracheal with a tube down your throat. So that risk is low. That's something you would talk to the anesthesia person about. So we found this to be a very effective treatment. It improves people's symptoms in 95+% of the time. So it can be a very effective treatment if you've tried conservative measures and you're still symptomatic. So that's a brief overview of ulnar nerve problems at the elbow. If you have any further questions or concerns, please contact our office or your local well-trained hand surgeon. Thank you.